So we're now going to call these events Talk Parish, which I think is hopefully a very appropriate way, because this is not about the council telling you about everything. This is about the parishes having an opportunity to talk to each other and to talk to us, for us to listen and provide some input as well. So hopefully the rebranding will encourage people to come along to this meeting. There's an overall reference group which now meets to discuss what plans there should be going forward. I think it includes some people from the parishes, so that's good news. And there will be a survey going out to parishes during February to ask what topics they might want to cover over the next, I guess, 12 months, Amy. So this evening, we're going to be talking a little bit about the integrated care system, ICS. When I was first elected as councillor, I suppose, which was May 2019, I thought council was about potholes, about planning, about dustbins and all that lot. But actually, there's an enormous amount more going on. And one of the key areas is actually working with the NHS and working on the health of people in the community. It's a huge amount, and it's partly a financial arrangement between the two organisations, because there's financial benefit by us working closely together and well together. But also as local authority leaders, I think we have a responsibility to do what we can to help with the health of people in our county, which is not the obvious thing that county councillors should be doing, but we are very heavily involved in that. And I think in Herefordshire, we are very fortunate to have a fantastic relationship with the local NHS and doctors. We seem to be small enough to be able to work really closely together, and we want to continue that relationship. Just one aspect is, of course, if we can work more closely to improve people's health at home, then there's less strain on the NHS because fewer people have to end up in hospital. So we want to work very closely with the NHS on that, because there's a gain to us both, in the both the community and citizens, as well as for the NHS financially. So that's what we're going to be talking about a little bit this evening. I mean, we mustn't be complacent about this work, the way this works at the moment. We just want to encourage it and help it, and get some feedback from you in your parishes as to what additional things we might be doing, and generally to explain what this strange thing called the ICS is all about. So we've got some guest speakers this evening, who I'm sure that Amy will welcome as the time comes along. So very much. Thank you very much.
Oh, sorry, Councillor Hitchener, we lost you a little bit there.
Yeah. Anyway, I'll pass back to you, Evie.
Okay, thank you. Thank you very much. So to start the session, we've got Paul Smith, who's just going to give a bit of an overview from community wellbeing and the council's perspective in terms of the ICS and the position that we play within the ICS. As Councillor Hitchin said, we've got Alan Dawson here today, who's Director of Strategy for Wye Valley Trust. We've also got Hazel Braund, who's Director for Transformation for the CCG / the NHS as well. And also Christine Price, who's the Chief Officer for Healthwatch in Herefordshire, is going to give us some overview as well in terms of Healthwatch's roles, responsibilities and involvement with the ICS. And we will have a breakout as well for and go into breakout sessions to discuss this and how parishes become involved with the integrated care system, what's their role, and how we can feed back into you over the next sort of coming months with the changes. So I'll hand over to Paul, if you're there, Paul.
Thank you, Amy, and thank you, Amy, for the introduction. Good evening, parish, county councillors, parish councillors and colleagues. It's great to see such an excellent turnout on an evening meeting, so very much welcome. I won't try to steal Alan's thunder, because Alan will give us far more detail on the system itself. But the integrated care system, commonly known as the ICS, is driven by legislation, but legislation that really drives behaviours that we should all embrace, hopefully. Our vision is that we work together as a local council and as parish councils and as county councils with the NHS colleagues for the greater good of the residents and the citizens that we support within Herefordshire. The ICS is a Herefordshire and Worcestershire ICS, but this evening is very much about what we do at place and what we can do at place, and of course what we can then do at the ICS level. So there's two functions to the ICS. There's a very much what do we do for Herefordshire and what do we do for the Herefordshire and Worcestershire combined. An enormous budget across the ICS, so 1.4 billion approximately of resources across Herefordshire and Worcestershire. And of course, Herefordshire is approximately a third of that, and the other 2/3 being made up of Worcestershire. The health and care workforce, which is the part of this ICS that I'm particularly concerned with, somewhere in the region of 1,200 people working in the health and social care workforce directly for the two councils. But then approximately another 12 to 15,000 people working within the care sector across the ICS in addition to that. It has many roles. It is encouraging integration. It's encouraging collaboration and joint working across health and social care. All of the NHS colleagues that are online tonight are individuals that certain myself and Amy engage with every day of the week, and it feels like we work for the same goals and the same organisations, whilst of course respecting that we all have our own constitutions. It's an incredibly important piece of legislation. We feel that Herefordshire particularly, and Herefordshire and Worcestershire, is moving in a very considered way to an integrated care system. And as we move through the mobilisation and the implementation of the ICS, we are finding wins for citizens and residents. We are finding better ways of delivering services and support, finding that Talk Community is no longer a council initiative. It is now something that is embraced by our NHS colleagues and is becoming part of the DNA of Herefordshire. And we believe that the parishes have got an enormous part to play in that, and we welcome your involvement. I will now hand over to colleagues, but I'd just like to welcome you to the parish, and on behalf of Community and Wellbeing, really engage with us, interact, because the ICS has something for everybody on this call and every one of the citizens that you support within your parishes. So hopefully you have an enjoyable session. Thank you.
Thanks, Paul. That's really helpful. So we're going to move on to now to Christine Price here from Healthwatch, to give an overview of Healthwatch, its role and function as well within the integrated care system. Christine.
Thanks, Amy. Good evening. I'm going to share my screen, if that's okay. Could somebody enable that for me, please? It's telling me I can't do it.
I'll do it now.
Thank you. So Healthwatch, our role, we are an independent organisation. We're one of 152 across the county and across the country in England, and we are commissioned by the local authority. So our role is to be the voice of the public. So that's people who use services and those who may not use services now, but it's important that we listen to them to plan for the future. So we do a variety of things, and the boxes on the screen here that you can see are trying to demonstrate to you that we provide a range of different services, if you like. So information and advice about health and social care, community development, which we work really, really closely with the ICS colleagues and Talk Community on, and I'll introduce you to something called the Community Partnership, which is integral to the ICS in a minute. One of the big parts of what we do is to listen to the public. So we do a lot of outreach, and we have priorities every year where we focus on very specific things to do bigger pieces of work, whilst at the same time we're quite reactive and collect information about anything people want to tell us through the information and advice line, through any general comments, emails, and we have an online feedback centre as well. So it's reactive and it's also proactive. So it's trying to make sure that we feed in the information that we receive from the public into all of the places where it can make a difference and shape the way health and social care services are planned and delivered. So the other part of our role is to involve people. So we use volunteers in the work that we do. And we also have a strategic role to influence, and that really is the part about where we're feeding in views of the public, and also keeping tabs on what's going in the developments going on across health and social care, to see, well, what's coming up in the future, what might the public really need to get involved in. And our role is to be at the table to say, have you talked to communities about this, and perhaps you should do it this way, could we help you in any way? So that's kind of the approach Healthwatch have. So we are independent, but we do like to work very collaboratively and help out where we can. And really the other role is communicating information to the public so that they can navigate and understand health and social care, how services are delivered and arranged, how they access services, but also key to what we're talking about tonight, the changes that are coming up in health and social care and what they might mean to people. So what are we working on at the moment? So these are some of the targeted pieces of work that we're doing, mainly responding to a lot of the priorities that are happening across health and social care at the moment, and things that people have told us are important to them. So some of those things are long-term pieces of work. So we'll always have a schools mental health forum and a Youthwatch engagement programme. Some of the other condition-specific things will change from year to year. So the Herefordshire Community Partnership is what I wanted to mention, because this is really integral to the ICS and Talk community, and what we're all trying to build together as a bunch of partners, trying to make the health and social care system that we have work the best it can for the people of Herefordshire. So on the screen you can see there that that's the aim, and the commitment is for us as a bunch of public, voluntary and community stakeholders to work together with our statutory partners. And the idea is that we are aiming that we should co-produce and design health and wellbeing and care services together. Now, we appreciate that's not always easy, and we don't always do it in every case, but the idea of what we're trying to do here, it's the start of a journey to work slightly differently. And I do believe that the integrated care system is a really good catalyst for this, because it requires us to work together, to listen to people together, and to not do things in silos. So the whole principle is a really combined approach. So Healthwatch and HVOS are leading that, but it's actually really, really key to the Talk Community Programme, and one of the ways in which we can help the Talk Community Programme is through the Community Partnership. So it's essentially at the moment some like conference events every other month, and the idea is this gives you a summary which I can share through the Parish Council network afterwards, but this is the summary of what we're trying to achieve, and these statements here have been shaped by partners within the ICS, Talk community, and also our voluntary and community sector organisations. So without going too much into Alan's presentation, this slide is to give you an idea of where it sits and how it relates to other things that are happening. So we've got the Herefordshire Community Partnership in the middle there, which really is feeding into the One Herefordshire Partnership, which is our executive leaders across health and social care that meet every week, and also linking to the Health and Wellbeing Board. So the idea being that the priorities that come from the partnership and also come from those two boards will filter up and down, and it's a two-way process. But recognising that we also need to link in at Herefordshire and Worcestershire level for those things that are broader than Herefordshire. So there's an equivalent movement in Worcestershire that looks slightly different but is providing the same kind of function, and we shall link together to make sure that we are linking with the integrated care partnership as it evolves. I think we're not quite on that journey yet, because we're not quite started the legislative changes that will bring that about, but as the Health and Wellbeing Board develop its priorities and plan in April to July time, the integrated partnership will start to look at what its strategy will be, and Herefordshire's community partnership will play a big role in that. Probably enough to say at the moment, Amy. Is that enough from those slides, do you think?
Yep, that's brilliant. Thank you, Christine. That's really helpful. And if we have an opportunity at the end, we'll sort of open it up maybe to questions, but we'll just roll through now. So now I'd like to hand over to Alan to give an overview of the integrated care system in terms of what it is and where we are and the next step.
Thanks, Amy. I'll share my slides too. Just give me a second. Okay, hopefully you can all see that. Yeah, I can see nods. Good. Okay, nice to meet you. Nice to be able to come and talk to you this evening. Alan Dawson. My title's changed recently. That's why my title's a bit different on screen compared to the one I was presented with. So I'm Chief Strategy and Planning Officer for Wye Valley NHS Trust. Really, first couple of slides here that I'll give a very brilliantly being preceded by Christine and Paul. These are the questions I'm going to ask you at the end, and I'll just put them up at the beginning, just so that you've got that in the back of your mind when we come to this at the end. Because one of the things we want to get out tonight is not give you some dry old slides about NHS legislation. It was really to get you thinking about what you think that the health and care priorities should be for Herefordshire, because behind a lot of this work, we're forming a plan for Herefordshire for health and well-being and health and care, and we're really looking for your input into that. And then there's what sort of involvement do you want as parish councils? And what kind of information do you require as a parish council? Many years ago was a parish clerk in Herefordshire myself, and it's difficult to know. Sometimes you get bombarded with information, don't you? And it's making sure that the information is right and at the right level and pitched to you as parish councils. So this first slide is really describing the some of the changes as we move into a system. So Herefordshire and Worcestershire working together in an integrated care system, and as already been said, that's subject to legislation that we'll see working its way through Parliament later in the year. But what's it all about? I mean, you can read these slides yourself. I suppose the things I would pick out are working at scale. That's the advantage to working across Herefordshire and Worcestershire, but with a focus on place as well. And place in this case is Herefordshire. So I shall, if I drift into the language of system and place, I really am talking about Herefordshire here. And it's very much about collaboration and less competition. If you think about the way the NHS was organised a few years ago, it very much pitched organisations against each other for commission services. And what that often did was drove competitive behaviour and didn't encourage collaboration. And all this is changing. I speak as somebody who's worked in Herefordshire for 20 years and for the last 10 years been working very much on attempting to integrate services. And as Christine said earlier, I think these proposed changes are the single best movement we've made towards supporting that integration of health and care services across the country. So it's much more about collaboration and very much bringing to the fore local authorities and that kind of democratic voice of elected members around the table as well. More sharing, more learning. We all benefit now from being able to pick up the phone much more to colleagues certainly in Worcestershire and learn from them and them from us as well. And then also collective accountability as well for our services and the issues that we have, and joining them up. I suppose that's where I would come on to. So what does it mean for Herefordshire itself? What does it mean for us? Well, it means a more joined up approach, and that's what a lot of these points are making on here. Much more of a shared approach to pathways of care for people, with less sort of handoffs between organisations, or if there are, we're much more seamless. Better collaboration with the voluntary and community sector, and Christine's talked a bit about that, and I'll talk a bit more about it in a moment. A whole population approach as well. So there's this opportunity to look at some of the wider determinants of health. You know, so often in the NHS we get caught up in dealing with the symptoms. We don't often deal with the cause. And you know, if you look at the centre of that slide, it's you know, very, very much about dealing with some of those wider determinants. Joining up information, very much siloed in the past, but now we're very much bringing those together and managing those information sets collectively, and getting a lot more insight into that locally. And I'll touch on that again later. And being more effective, really, better use of resources, and helping people to help themselves. I think that's that's very much what we're about here. So I'm going to talk less about this, and again, now Christine had a slide that was exactly the same as this, and it's much better than this one. So I won't dwell on this, and she's already talked about that. But the community partnership there really is the group that Christine runs, and that's a brilliant way of getting feedback from patient groups, public representatives, and the voluntary sector, and a really powerful approach. It's something I think as organisations, certainly to speak to my own organisation, we've never done particularly well, but doing it collectively through Healthwatch like this, it really is a massive opportunity in improving, bringing to the fore that voice, and in co-producing our improvement practices. I'd point out the One Herefordshire partnership there. So that very much a partnership of bodies in Herefordshire, including Herefordshire's general practice, so GPs, Herefordshire Council, our mental health provider, that's Herefordshire and Worcestershire Health and Care Trust, we provide mental health services across both counties, and Wye Valley NHS Trust, my organisation that provides acute and community services. So Healthwatch are part of that as well, and so are our commissioners, Herefordshire and Worcestershire CCG, which will migrate into the integrated care board. You'll see there. So at a system level, across Herefordshire and Worcestershire, you'll have an overarching care board that's the accountable body for commissioning services across the two counties. And then an ICS partnership board, which is very much that stakeholder organisation, a part of that organisation. I won't talk too much about that because we've already covered it. It's this that I wanted to focus on. So if you look at what we're trying to do is develop a plan for Herefordshire that matches that focus on Herefordshire as a place. So we're working together across the two counties, and we'll develop a plan for the overarching ICS. But at place level within Herefordshire, what do we want? What are our priorities? What are the things that we're going to focus on? And when setting your priorities, you need to look at a number of things. What are your local priorities? And that's one of the reasons I'm here tonight, is to facilitate a session about that. What are the national priorities? What do the government tell us that we need to do, both for health and care services? Regionally across the system at Herefordshire and Worcestershire level, what are our priorities there? What are the public telling us? And what are our practices and general practice telling us as well? So we kind of bring that all together, and this is what we're doing. But I'll describe that as we go through. From a Herefordshire Council point of view, they have a body which was on the previous slide, the Health and Wellbeing Board, and that's very a number of elected members present tonight are party to that group, and they some time ago have set some a vision and some priorities, very high level priorities, that we're kind of working on the detail around that at the moment. So as you can see there, resilient, fulfilling lives, physically healthy, that sort of thing, and then some priorities below that: eating well, drinking safely, living life to the full, supporting vulnerable residents, mental and emotional well-being, and keeping people connected. So that's the overarching framework really for our prioritization, and it's this that our plan will underpin this, so that we can show the Health and Wellbeing Board that we're supporting their priorities. In terms of the NHS, I kept this slide in. It's actually changed slightly. This is the planning priorities for the year coming. Came out on Christmas Eve, as they always do in the NHS. These are the ones for the current year. So they're pretty much the same. They haven't changed much. But so our priorities in the NHS: health and well-being of staff. Obviously, staff are very tired and have had a tough time over the last 2 years, and their health and well-being is paramount. Delivering the COVID vaccination programme. I don't need to talk a great deal about these things. I think we're all well aware of the efforts going on around this. Restoration of elective care. As you probably headlines that you heard last week across the country. I think we're up to 6 million people on waiting lists now. Good proportion of that in Herefordshire. Very, very long waits, as we've had to put aside elective care to deal with the emergency response to COVID, and that's suffered. And we realised that we've really got to restore those services and work our way down that waiting list as quickly as possible. So that's a priority, as is obviously restoring all cancer care as well, which in Herefordshire we've done a pretty good job with. Mental health services and the transformation around those are a priority, as is access to primary care. Again, another one certainly in the news locally and nationally. Primary care are working very, very hard, but it's not always so visible when a lot of their appointments aren't necessarily always face to face, and they're delivering the vaccination programme across the county as well. Community and urgent and emergency care are also priorities. And then obviously the work we're doing now, working collaboratively across systems to deliver these priorities. So that's a priority in itself. My view on this, if you ever look at NHS priorities, it's actually a shorter list, I always think, to write a list of the things that aren't priorities. Because if you look at that, it's pretty much everything we do in the NHS. So that's my view on that. You'll see there that there's some comments there about retaining a focus on tackling inequalities. And that's something we're really trying to get to grips with in Herefordshire. Inequalities have widened during COVID, the inequalities that already existed, health inequalities, and we really do need a concerted effort to focus on that. And we've got a group together across Herefordshire from all our various organisations through the One Herefordshire Partnership, looking quite closely at that at the moment, formulating a plan. So in terms of that One Herefordshire Partnership, so locally, what are our priorities? And these are our kind of immediate priorities at the moment over the last 6 months. These that have changed in the last few weeks. Prior to that, a lot of the priorities were based around our response to COVID. And we're looking a bit more strategically now. So Herefordshire has been very lucky in recent years, and has a massive investment in digital systems in healthcare. I know my own organisation were very digitally immature, and we're now kind of in the middle of the pack around that as an NHS organisation. More and more, less and less reliance on paper notes. We've installed these systems, but we need to maximise that and really benefit from that, because there'll be massive benefits for patients if we're less reliant on carting huge tomes of paper about. Workforce development, big issue in Herefordshire, recruiting to the kind of key worker jobs, care workers, nursing jobs, medical appointments in Herefordshire. Inequalities I've talked about. Integrated teams, so we're all working in a more integrated way, and I talked in my experience of trying to integrate services in Herefordshire for the last decade. You can put people in a room together from different teams and tell them they're a team, but it doesn't mean they work as a team. And so what we need to do is put the necessary development in place when our various teams, be they social workers, district nurses, general practice, coming together in localities within Herefordshire. As they need development to be able to do that. So that's one of our priorities. Diagnostics I won't focus on too much, but we're very much trying to increase our diagnostic output and reduce our waiting times around that. And again, a shared approach to waiting list management. We've got a lot of people on our waiting lists, and we realise there's a risk, obviously, to that. And what we're trying to do is manage that together with our colleagues in general practice, so that we can manage the risks around that and maintain patient safety. As you won't be surprised, respiratory care is a priority for us, and so is urgent care, as ever, trying to deal with, trying to get people the access to urgent care as quickly as possible and close to their own home as possible. In terms of our primary care teams, and we have a number, 5 of them across the county, represented here. We asked them for their top priorities a few weeks ago. They came up with these lists. I think if you look at them, a lot of the teams have come up with similar sort of things, even though they did this exercise separately. So I've just picked out things like obesity, mental health, integrating their teams, and you'll see common themes here as well, and frailty there as well, dealing with frail or older people. So what we're trying to do here is refresh this plan. This plan on our left, it's the kind of strategic dartboard, as we always call it, which has the person, the resident in the middle, and all the services that wrap around them, and the strategies that we have to kind of support that, support people's help them, helping them to help themselves. But what we're trying to do is refresh this particular plan, and we're working on this at the moment. That's why we're very interested in hearing your views and our priorities. And on the right of this slide, it's just very much bringing together our local health and wellbeing board priorities, our locality priorities from our primary care teams, the national priorities, and then the views of organisations like yours and people like yourselves, to bring that together into one plan. So that's the end of my presentation, and I think we move on to a sort of facilitated session. So it's with these questions that I think we're on the agenda. So based on what you've heard and based on your experience within your parishes, what do you think the priorities should be that we focus on within Herefordshire? What involvement do you want as parishes? Is this sort of session helpful? Would you like more done at parish level? And what information might you need to do that? I'll take my slides down if I can, and hand back to Amy.
Thank you, Alan. Really helpful, really good overview. So yeah, so as Alan said, we're just going to move now into some facilitated sessions, just for about half an hour now to go through those key points. We've got some facilitators in the room. It will be Christine, Hazel and Alan, and we have some note takers as well in there. So and Vicky will start to call us back when we're after about half an hour, and we need then come back and we'll give have maybe a bit of a discussion as a joint group. So Vicky or Lorna, are we ready to go?
Yeah, I'll get everyone going off now, so you should all disappear into your breakout rooms, and I'll call you all back in half an hour.
Thank you. Hello.
Hello, everybody.
Hi.
Hazel. Hazel is our
Hello.
facilitator. Oh, hello, Hazel. Sorry, I couldn't see you as you popped up then.
That's all right. That's all right, Lorna. Lorna, I think you're doing notes today, aren't you, for us?
Yep.
Thank you very much for
Hello,
that. And have we got everyone? Is everyone in the room now? I think they are. There's quite a few of us. Okay, so I'll introduce myself. Amy gave me a bit of a surprise title there. Well, I've come across some of you a few times. So my name's Hazel Braund. I'm Director of Partnerships for the CCG, and I'm also the CCG's Development Director for Herefordshire. So I work very closely with the partners across the Herefordshire system, and that's where my main focus of work is now. I've worked in Herefordshire for 8 years now, so since 2014. So I did have a brief break. I went on a secondment into Gloucestershire for 18 months. So if you're wondering, where did she go? That's where it was. Anyway, so there's quite a few of us. We've got 3 questions. The first is around what do we think our priorities should be? The next is what level of involvement the parishes want, and then what information might assist the parishes in delivering messages to residents. So we've got 30 minutes, so until about 10 past 8, I think that gives us, Lorna. And I'll be asked to do is to just present our top level thoughts back. And as I'm doing that, I'm very happy for you to intervene if you feel I've got it entirely wrong. That's fine, I'm sure you will. So let's start off with what do the people in the room think the priorities for the integrated care system should be? What have you heard that you think will be helpful? And are people going to be able to put their hands up, Lorna? I don't know how. So I can see a hand, but is there?
Yep.
I can't see everyone at the same time.
Yes, let me say there's a few, maybe with gallery, have a gallery view.
I'll try the gallery view. All right, but I did see Steve Kerry. If you want to introduce yourself when
yes, you put, sure. Steve Kerry, I'm the clerk to Hereford City Council. My apologies for a late arrival. I didn't get the message that this was on Zoom. My diary still had it as a Teams meeting, so I spent an intensely frustrating 20 minutes wrestling with Teams. Thank you to Vicky Lonergan for solving the problem, and Councillor Hitchener and Paul Walker, you have an email saying what I think of Teams, but feel free to discard it because you've gone on to Zoom. I just wish somebody had told me you've gone on to Zoom. Now, I was very interested in the references to inequalities in health. We all know they exist. But I just wonder, how is that monitored and what sort of equality impact assessments are done? Because I've been hearing about inequalities in health ever since I did my politics degree in 1976. And I just wonder why, if we've known for 40 years we've got them, why have we still got them? Are they any better? Can they be measured and can they be addressed? I think it's really important in an area where you have some really low income areas, as you do in Herefordshire. There's rural deprivation, there are pockets of urban poverty as well. And it's a really big issue that's sometimes below the radar.
Okay, thank you, Steve. So I'm afraid we're not going to answer those questions today. I think that's a really articulate outline, though, of that as the priority that we need to address. So do other people have thoughts on inequalities or on other specific areas? Councillor Summers, apologies if I get people's titles wrong. I can only see your name. I just happen to know that David is a councillor.
That's fine, Hazel. I guess we should leave this to the parish councils, but I did put something in the chat because equality came up in the last speaker. And to be frank, we don't really have equality in the NHS right now. It's very one-sided. If you're sufficiently wealthy, you can get private help quite fast, and it's harder to get a doctor on the NHS quite often because they have to take care of their private business first. So I'm concerned for my parishes on the working poor, and that's who I have in most of my parishes are the working poor. And to tell them that they're equal to the rich farmer up the road that can get private help and pay for it, it's a bit of a bit of a concern. Anyway, that's a start, I think. Thank you.
So that's another big vote for addressing inequalities. Thank you very much. What are other people's views? Other views on addressing? I think what Steve started us off with was not just addressing, but it was also understanding, measuring, and addressing. So, Lois Newman.
Can you hear me?
I can.
Right. I think we're at the sharp end. We're the people who have to deal with all the complaints, with the people who come out of hospital, who have no health care. So really, I want you to not just talk about doing all these things, do them, do something about it. We've got one person who has discharged herself from hospital. She was bed blocking. There was nothing. She'd had a hip operation, but there was no healthcare workers for when she came home. So, okay, neighbours have opted in and helped. But that was something, so many people are bed blocking. And that's part of the problem. I just feel we're at the sharp end. No one can get an appointment at a doctor's surgery. If you do, you have a telephone appointment and then they want to see you. So you're doing two things at once.
Thank you, Lois. So I've picked up a couple. I think there's something about the role of the parishes, and I think we can come on to that, can't we, in terms of how.
Yes, I'm sorry, I've probably come out the wrong question.
No, it's never a wrong question. But so I think you've given us quite a rich range of things. You've got there's people after they're discharged from hospital, there's insufficient care for them in the community. You also mentioned that people are struggling to get an appointment with the doctor, and you've got this wider point about communication. It's really valuable. Thank you very much for sharing that. Really helpful. Other people's views. What else do people think? Mark from Pixley and District.
Hi, good evening, everybody. I'd just like to raise something that is obviously very topical, and that's COVID and the effect of COVID. So bringing it right down to parish level, this has been one of the most, I'm going to use the word divisive topics that we've had to discuss, where some of our councillors, and I do stress councillors because I'm sure, like a lot of parishes, we do struggle to get parishioners to actually attend our meetings, but very concerned about what information has been given, what information we can get, and what support we can give. But absolutely topical at the moment is the lack of availability of kits to self-test. And I've had several emails where people are asking, what can I do to get a kit? And people are going into the pharmacies in Ledbury. They are obviously using the app to try and order kits, but it's just so limited. And is there something that Herefordshire Council can do with the local NHS departments to get kits out to local parish councils, where at least we could have them on hand to distribute? And I really think that would bridge an enormous gap and just show that parishes and the council do care about something that's absolutely front and centre at the moment with healthcare.
Thank you, Mark. So that's a very specific issue around the kits, and it's actually, unfortunately, there's not a lot we can do about that. It's nationally driven, but I think your wider point, I think it does touch on a really important wider point about us giving you information and working more closely with you in this kind of scenario, which really touches on something that Lois picked up as well. So lovely. I don't want to appear to be dismissing your issue about the kits. I really wish I could help you.
No, you're quite right to pick up the part about communication
and sharing information, shared responsibility. Yeah, really good point. Lois, your hands up. Is that an
sorry.
That's all right, don't worry.
I'll take it down.
I don't want to fail to ask. You can have more than one point. Who else? I can see you all now in a gallery, so I can have a virtual or a real hand.
I can see David Councillor Hitchener's raised a hand.
Councillor Hitchener, would you like to?
Yes, just to deal with Mark's question. I'm told the best way of getting set testing kits is to contact the NHS is it nationally by email, and if you'd like to let me have your email address, I can send that to you. My wife ordered some yesterday, and I'll let you know whether she gets any soon.
If you go on the website first thing in the morning, so my daughter's a student, and she goes on the website, she's got time, goes on the website first thing in the morning and gets them delivered, but they are it's going to slow down. But yeah, good advice, David, thank you.
Okay. But then you were asking then about sort of longer term aspirations. I mean, I would like the goal, or one of the goals, to be early intervention, really, and enabling people to stay in the community for longer. The approach of mental health to keep, public health, keeping people at home, and helping people in the community. So, obesity is an issue, isn't it? What we can do to try to keep people healthier at home, so thereby taking the pressure off the NHS. And I know that's a long-term thing. We talk about waiting lists and operations and everything, and that's the big focus, but we mustn't lose sight of the importance of just the general population health and avoiding the pressure on the NHS, which might be 5 or 10 years down the line. If I was to have a request, that would be mine.
And I think that ties in really well with what Steve Carey was saying at the beginning about what we know about inequalities, because a lot of things like obesity tends to be more dominant in our less affluent communities. And yes, prevention. So there's another one. So early intervention, prevention, working together as a system around those issues. What else? What other things? Any other comments on? So we've still got a while. So Kevin from Foundhope.
Hello. Yes. Yeah. I'm from Foundhope Parish Council. I should say first of all that here in Foundhope we have a great medical centre, and they provide an excellent service to the surrounding area as well as the village here. But they are still in a situation where it is more difficult to get face-to-face appointments than it was before the pandemic. They have reopened, but it's still not. You have to go through this, as Lois was saying, this process of having a telephone appointment. So I think it's really important to get more face-to-face appointments, particularly for some of the sort of more elderly and frail people, because they're the people that are more isolated and perhaps kind of fall underneath the radar. And so that I think ties into the question of social care, that we need to improve the availability of social care, which would also go some way to dealing with some of the waiting lists for hospital admissions. And there's a lot of people who are taking up beds and they don't really need to be there because of the lack of availability of social care. The other thing, I continue to be quite surprised at the inability of the NHS to set up a sort of computer system that allows GPs and consultants to communicate together. It's just unbelievable to me that in this day and age we're using different computer systems, and so there's no communication between different health professionals. I'm not sure that any of these are really within the remit or within the sort of the reach of a county council. To me, these are all things that.
No, these are all things that are high on our agenda. So absolutely. So face-to-face appointments, we're here. A lot of people are sharing their concerns about that. We understand it, and we have to balance that obviously at the moment, in particular with infection control. What you're talking about in terms of increasing social care and availability, with that, when we talk about integrated care, so I think both Christine and Alan talked about integrated care. That's what we mean. We use a lot of jargon, don't we? We use words in a particular way. What we have in Herefordshire actually is our social care staff and our health staff working very closely together. So they have a single discharge hub, for example. But yes, we would totally agree with you around working together around social care. And we're doing there's some joint recruitment going on now. So we're looking at how we can develop, if you like, an offer to people as health and care providers for coming into the care sector as a career, to try and build up the workforce, but also do what you're saying. And then your point about shared data, I don't think there's anybody in either health or the council who would disagree with that. And actually, we are moving that forward at a pace, and it absolutely is in our gift. Our data, our IM&T lead would start talking to you about a data lake, and but the ability to simply share across boundaries, it's massively improved. But yes, we've got more to do. All really valuable points. Thank you.
There was one other thing.
Oh, go on, keep going. Yeah, no, it's good.
Somebody mentioned preventative medicine.
Yeah.
And I think there's, real value in doing more, not sort of early intervention, but health check type of work to, identify health problems before they, actually manifest themselves as, an issue that somebody takes themselves to see their GP with. We're constantly told that early diagnosis is the key to, particularly to dealing with things like cancer. And there are now, diagnostic tests that are coming along that can identify, malignancies well before they actually manifest themselves. So I'd like to think that will become part of a sort of a regular health screen that everyone's invited to. At the moment, you go for your health check and they take your weight and your blood pressure and maybe do a glucose test, but that's about the limit of it, I think.
There is more coming along. There's more being trialled in different places, but absolutely it has to be. We tend to look for targeted health checks. So general health checks generally involve a lot of resource, so that they tend to be targeted, but there's lots and lots, particularly around cancer, as you're obviously aware, lots of things coming along. So absolutely. Councillor Summers again.
Thank you, Hazel. I think one of the main things, and it's very general, and that's communications is a major issue. Doesn't matter which direction you go in, whether your council, whether you're NHS, or whether you're a parish councillor. But Kevin brought up something about the data, and that's again communications. Now, when we went from Gloucester, when the mental health went from Gloucester to Hereford Worcester, they couldn't even communicate data-wise because there were two conflicting pieces of equipment. And now we've probably got that straightened out. But if we want to communicate with Gloucester, our data doesn't match our database doesn't match theirs, so we can't really communicate with them unless we do it by hard copy. So it's a constant with this, and you would think the NHS being generally one organization per se, I know it isn't, and it's a little, but you'd think that they would have the data all in under the same umbrella, or make these big machines talk to each other better. Anyway, just
it's a really important basically point. Yeah, really important point. Now, so I'm just going to take one more comment, and then I think we've got 10 minutes, so we'll move on to the level of involvement you want and how we communicate, which we've begun to talk about. So I've got Mark has got a real hand up. Go on, Mark.
Just one on communication. So I had the opportunity to go to witness another parish council, another local parish council, and how their meetings were being conducted. And what was really good was that their particular ward councillor had prepared a report. And I don't get this for my particular parish council, but wouldn't it be good that when messages are being given at Herefordshire Council, that there's a standard report that each ward councillor could use as a template that has that key information? They can add their own local report onto the end of it, give that to the various parish councils, and at least we can then put it on our websites, we can discuss it at the meetings and try and get it right down into the communities, to the people that matter. because I'm sure that there's so much information that isn't being processed through right down to that bottom level. Not everybody has website access, but we've all got a notice board perhaps. And I'm just thinking, is that a way that we can almost get to an analog form of communication just to ensure that everybody has an opportunity?
I just jump in with that one. I just jump in there.
Hold on, David. I've got a couple of others as well. Have you finished, Mark? Thank you. Go on, David.
Yeah, Councillor Hitchener puts out a report every week, and so does Paul Walker, and those can be shared, I understand, with the parishes. So that's up to the ward council, I think. I know I share them with my parish councils. I'm sure other councils do too, but perhaps more need to do it, or perhaps Councillor Hitchener can tell the ward members that his letters can't be shared, because they're very useful. They give a good cross purpose of everything that's happening in council, and it's all in one place. Anyway, I don't know what John Hartwick thinks, but I think it's useful. Thank you.
Is this thank you, David. So is the suggestion that we should look at that kind of approach? So look at what Councillor Hitchener and various others are doing and Paul Walker's doing, and begin to bring into that some of the integrated care system information as well. So we establish, as you've said, a regular stream of sharing of information that then we could potentially use to share key health messages. For example, please have your booster. And if you haven't had any vaccinations, you can still do it. Is that the kind of thing? So you're looking for a regular,
that standard approach, that standard approach.
That regular, simple, standard approach, Now, I'm conscious that Chris Bucknell put her hand up. Chris, did you have something additional to add?
Not really, no. I was just going to echo what David had said. I was just going to say, I do want to say that communication is excellent. I mean, we get the leaders newsletter out every month. We get reports from our ward members to the parish councils. I mean, I can't say enough about it. I think it works extremely well. So I just wanted to add that.
So what we could do is we could use that really well-established system to begin to see if we could add some things in. Councillor Hitchener, I'm going to put you on the spot. Do you think that's something that is worth us talking to the council about? Is that something you would welcome, or do you think we should do something separate?
I think it would be a very good idea. It has to be non-technical and kind of yes.
I don't think that'll be a problem for the NHS, given what we were talking about.
Well, within the council, you can have council speak, or you can try to have sort of more common speak. And I try to keep the council speak out of it. So it's not written by an officer. It's written, sorry, officers who are on board. It's not written by an officer. It's written by me and by other cabinet members who actually, well, I was going to say a little bit in the context of the NHS. It's kind of written by a non-executive rather than executive.
Well, we sometimes use Healthwatch for things like that as well, so we could get Christine to advise us. So.
And actually to get something like that out every month, divided into nice, neat little sections. I mean, what are the waiting lists? What are the delays? What are the problems? So it's actually got to be really honest as well. So it's not coming out with good news; it's coming out with bad news too, so that people can understand how long they're going to have to wait, and maybe there's a new bit of a kit that's been bought. Well, that's interesting. Or so a consultant's retiring. You're trying to recruit new people. Just things like that, which I think it's a very good idea. I hadn't thought of that, but I think it's a brilliant idea to have something.
Great idea, nice and simple. David from Marden Parish Council.
Yes, I'm from Marden Parish Council. I'd just like to say I am all for communication, and I think what's just been discussed is extremely useful, but we're going from a position of almost no communication to communication overload. And I think we really do need to think about targeting the communication to where we want to achieve the greatest impact, rather than just push out lots and lots of information without understanding what it is trying to achieve. Particularly in parish councils like mine, it's much better to be focused on something than trying to get people to read an awful lot of information.
Yeah, so key messages. Yeah, I think you're absolutely right. Very true. We don't want to overload. We want to, because we'll lose the message. Really good point. Anyone else on comms? Okay, I think we've got a great suggestion there. And then the final bit is what level of involvement. I mean, I think you're pretty clear that you want to know about more, and you're very happy to share. What other involvement do parishes want? Steve?
It's not so much what we want as something we already do. We are very well connected with our local voluntary groups who are really important in this area, particularly supporting people who are isolated in communities with mental health issues, some of which are just about isolation and loneliness. And that very local support of neighbour schemes and visiting schemes and funding local groups is something that we're probably best placed to do. Many of us are doing it. I think almost every parish is involved in some way or another in supporting voluntary activity in its area. And the more we can encourage and support that, and just from time to time share what we're doing and learn best practice from each other, that would be very useful. It doesn't require a huge amount of top-down organisation. It just requires a bit of facilitation, and let us get on with it.
So that would be about us making sure that we're talking to you and listening back as well, and so that you can tell us what the groups and things you're doing. That's really helpful. Thank you. Kevin?
Yeah, again, to follow up on that, we have at our medical centre, they have a social prescribing group, and part of that programme is an organisation called COCO, Compassionate Communities, and it's basically a group of volunteers in the village who have a couple of people assigned to them, and they just go and take them out or sit and have a cup of tea with them every so often, and then they organise the coffee mornings and things where they get together and give these isolated people the opportunity to meet other people, and it actually works very well. That's something that
that's a great example. Yeah, and that's been going for some time in Found Hope, hasn't it?
Yes. Yeah.
Yeah, that's a great example of how we can work with parishes and with the practices. Who else? Any other thoughts around level of involvement from the parishes? Or is that something that's going to develop? So if we start communicating and talking to you, is this kind of event going to be something that maybe you can then feed back to us to give us a better sense of what involvement you want in Talk Parishes, maybe? Do you think that will evolve as we begin to actually talk to you a bit more effectively? You nods, David?
I was just going to say this might be leading into your area anyway, but I think Talk Community and Talk Hubs and community hubs is what this is about, really, and training people within the parishes to be able to do certain pieces of work within the parish that help meet the overall aims. And we've only just started in Marden. And so I hope that's the way it goes, because it's a focused way of doing it. And parishes are in touch with Herefordshire Council then all the time about progressing that.
Yeah, that's a really good point. And the One Herefordshire Partnership has been strongly supportive of Talk Communities. And I think those community hubs are clearly a good way of us getting involved. And we've got 32 seconds and counting. I think are you all seeing the countdown, as I am? So thank you very much, everybody. I've got quite a lot of rich information here, a lot around inequalities and prevention, really great ideas around communication. So thank you very much for your contribution. That was a really interesting discussion. And I think this will be the beginning of the dialogue, I hope. I don't think it'll end here. So you have lots more opportunity. See you in the main room.
Thank you. Thank you, Hazel.
Right. Hi all, back together again. I think Vicky, is everyone back back in the main room now? Everyone's come back from their group breakouts. Yes, I think that was a yes.
Yeah, they have, yeah.
Okay, great. Well, I hope you found that useful. I think we had a, just talking on behalf of our group, I think we had a really, really good dialogue, really good conversation, some really good suggestions and ideas coming forward there. So thank you for that. What we'll just do now, we'll just go around the facilitators or note takers and just give a bit of a feedback into the group in terms of what was said in those individual sessions. So if we start with Hazel's group, I don't know if Hazel yourself are going to come back. Yes?
Yeah, very happy to. Thank you very much. We had a really good discussion and great engagement from everybody. So thank you very much. So there were a lot of common themes that came up. So a lot of discussion around inequalities, challenges around what do we know about inequalities? We've been talking about this for 40 years. Very true. Good challenge. Have we done anything? How are we measuring it? So a lot around that. And I felt like a strong commitment, lots of support for that. Discussion around prevention and early intervention. Again, lots of support for that. And that came into the discussion we had later on about the involvement of parishes, and an example from Found Hope about the social prescribing compassionate communities project that's been running there. So that whole early intervention, both across health interventions, but also around social care, screening as well came up. Can we do more to give access to screening so we can support people to avoid illness early on? Someone made the comment that parishes are at the sharp end. So parishes hear the complaints about things that have happened, and a comment associated with that about there's not sufficient care for people when they're discharged for hospital. But again, that ran as a bit of a theme in terms of, as we get into communicating and involving parishes, how can we recognise and actually use that sharp end, that personal place, and to learn and to share information. So that was helpful. Another really helpful challenge around why on earth can't we share data more effectively, which I gave a wry smile. And I did say, actually, if Mike Emery, our IT lead, was around, was on the call, he would be talking about data lakes and about how actually we are improving. We will get there. It's going to take time, but very good challenge. And then we talked a bit about a call for more face-to-face appointments, understand that, and increasing availability and integration of health and social care. So we had a discussion about comms and a really great suggestion around taking a simple approach, but moving to regular reporting, maybe either linking with or looking at how the council communicates through the cascade, out from the council, from Councillor Hitchin and also from Paul Walker, out to the councillors and to the parishes. Could we begin to put messaging out through about health, sharing facts, honest facts, but also giving simple messages and warning there to say, don't overload, but taking a simple approach, committing to it, some kind of monthly communication, which felt like a really great bit of advice there. And then finally, the bits around involvement, reminder that parishes are well connected into their communities and well connected into the local voluntary and community sector. And actually, again, going back to that, building that regular dialogue, having a two-way dialogue so that we can explain what we're up to, give a bit of a forward view, and then parishes can tell us how they think they can contribute. So really good discussion. Have I missed anything vital? I did say to my group, just jump in if I've missed something.
Sounds yep. Sorry, Lorna. Yeah, that sounds a really, really rich and useful discussion there. Some great things that have come forward. Okay, so Christine, if I can come to you.
Yeah, thanks, Amy. We had quite a few suggestions around priorities that are already existing priorities with One Herefordshire, thinking about access to services and various long-term conditions, etc. And then we had some recurring themes around mental health, loneliness, and children and young people's quite a holistic conversation. There was lots of aspects around children and young people, not just mental health, but prospects, employment, and that kind of thing. And that actually the outlook for young children and young people is not as good as it would have been 20 years ago or so. So was that something we could focus on? Other comments were around ambulance response times and community transport, some of those around our rurality that affects that. And then we went on to talk about part 2. So things that the parish council said would be useful for them was regular feedback on ICS developments to parish councils, parish council briefings to understand what's going on with all partners, not just the council, helping the parish councils to understand what we have in terms of provision of services, so that they're armed and tooled up, if you like, to help the people that they serve that come to them with the issues. And we talked a bit about essentially needing some kind of information hub, some kind of way that we can do an ICS comms piece that worked as a two-way thing, so that you were telling us the issues, the thorny issues that the ICS are addressing, but equally what parish councils are hearing and feeding in. And also digital access also came up in our group. So question 3, we didn't have a huge amount of time left for that. But what we did say is feeding the parish councils with information to be able to utilise what they already have. So their newsletters and parish newsletters, there's a rich network there that we're not tapping into nearly enough to communicate with residents. And the point that we got cut off on was from David, and he was saying that actually, in terms of priorities and all of the answers to these questions, tell us what the art of the possible is, and we can tell you what we think, was I think the crux of what he was saying. And we had a couple of questions about commissioning, and Paul will pick those up at the end, because I think they'll be of interest to everybody. Anybody else from my group, anything to add that I haven't mentioned? No. Good.
Thanks, Christine. And again, some really useful conversations, and some from what we're hearing already, probably some quick wins we could probably take from tonight in terms of certainly the connection and network we got through Talk Community, where we could get some information out quite relatively quickly. So Alan, can I come over to you next? I'm conscious you might not have taken too many notes in that discussion, but
that's all right. Fortunately I did. Okay. No, I was a really good conversation. Again, we had a long conversation about digital and the importance of that, and the importance of digital inclusion, and the fact that not everybody's got access. They haven't got broadband, it hasn't reached their part of the county yet, and therefore those inclusion issues and providing alternatives for people. And then a conversation about how digital very much needs to be about supporting people, but we can't lose sight of the fact that this is about people, and we need to focus on people and not losing sight of that. And I thought that was that was really helpful. Interesting one for Hazel as well. Dentistry came up a couple of times, and again, I think we sometimes locally lose a bit of focus on that. It's a big priority for people. I speak from personal experience. I'm sure we all do. But I think a lot of these services are commissioned regionally or nationally, but locally in Herefordshire, certainly we in the NHS lose a bit of sight of that sometimes, and that came across strongly to me. So that's not something I personally considered up to now, but I thought that was quite an interesting conversation. And again, we got into talking about Talk Community as a conduit for this information, and the Talk Community newsletter. Certainly an appetite for getting information on the ICS and the developments that we're putting into place in Herefordshire. The style of communication being important, keeping it short, watching the abbreviations. That was helpful. Perhaps visiting Talk Community hubs, and I certainly think that's an opportunity for the local teams to be to access those. We talked about access to diagnostics and to primary care as well. So a lot of the things that have been discussed. So yeah, it was a really rich conversation and got a lot out of that. So thank you.
Brilliant, thank you, Alan. Sorry, my internet connection went in and out there a little bit, so I think I'm back now. Brilliant. So really great again conversations that we've had there today, and I think it's for me it's really the start of the conversations around this and how we certainly with parishes and how we can sort of take this forward and to engage in further with you in this, and also under that Talk Parish initiative that we're trying to launch here tonight, and how we do have this two-way engagement with you certainly on these key big topic areas that directly affect all of the residents. So really that sort of brings us to the end of the session today. We just wanted to focus in on the integrated care system, and I would like to thank Alan, Christine and Hazel for coming along tonight and providing that overview, because I think it's been really helpful, and thank you for taking the time out to give us that information. Becky Howell-Jones isn't here this evening, but she has suggested if there are any direct COVID questions that you particularly may have, either hang on at the end and we can take those, or pop them into the chat and we can take them back to the team on that. We will also circulate all the slides from this evening, and we will take some notes. We've taken some notes from the sessions and the breakout, so we'll pull that together, and obviously we'll circulate that to everybody. We'll also work closely following this with Alan, Hazel and Christine with the Talk community team to think about actually some of those, like I say, potentially looking at some of those quick wins and how we take this forward in terms of some of those great suggestions that you've discussed and we've brought forward tonight. And I'll just bring Paul in. Paul Smith, is there anything from your perspective you just wanted to cover and round off for this evening?
Thank you, Amy. And thank you to all the attendees. Great interactive session, really productive, and some really good feedback from the parishes that will help to shape and co-produce the ICS going forward. Particularly thank you to the facilitators and to Christine and Alan, who contributed on behalf of the NHS and partners. A strong theme that came through was data and information sharing in both directions, both to the parishes and from the parishes. I think that was very important. And in terms of one of the themes that came through is a very interesting question that came in the group that I think is sort of sums up why we're here. And it said, what can we do with the ICS or being part of the ICS that we couldn't do if we didn't have the ICS and we had more resources as a local authority? A great question, and of course it's the what if question effectively. But I think that the answer is that we could, of course, receive more resources as a local authority, and of course we always want to. But even with almost unlimited resources, we still couldn't achieve what we could and can achieve with the ICS, because we couldn't achieve the integration and the collaboration that we've achieved, and we are beginning to really see the benefits of, because we'd still remain two separate organisations without that integration and collaborative agenda. And I think that as a system, it is all the better for the ICS because of the fact that it exists. And of course, resources are always welcome, but I think we can still achieve more collaboratively as an ICS than we could as separate organisations that didn't work in an integrated way. In terms of the next steps, would you like to do those, Amy, or shall I take those that you've documented?
No, you can do that. You can do that.
Obviously, this is the first of many Talk Parish sessions, hopefully. The new branding is now in people's psyche, and hopefully will start to become visible to many people. For the next session, we'd like you to contribute to the reference group, if you could, to discuss the principles of working under Talk Parish, the new brand and the new approach. We'd like you to suggest what you'd like for the next session. So this is your session as parish councils and parish councillors, not ours and not the county council. So it's very much what would you like in the next session. We'd really welcome that feedback. We really appreciate your involvement this evening and hope that you found it useful and informative. And I'd just like to say good evening to everybody. Thank you very much for attending. Please keep safe and well, and hopefully these sessions will continue and become incredibly valuable, as they already are starting to feel.
Thank you, Paul. Just to add to that as well, we will be sending out a sort of small survey to all parishes over during February around things like what are the key themes you'd like to see here, what would you like to discuss. But just picking up with Ling Langford's query in the chat, that we do have a Talk Community Inquiries inbox that will circulate. If you've got some suggestions, then a great opportunity for you to feed that into us, and we'd be really willing to receive that feedback. But we will be sending out and circulating that survey throughout February as well. So Councillor Hitchener, I don't know if there's anything you wanted to particularly finish off this evening with.
Well, I was going to say that I think we've got a couple of items for future Talk Parishes, Section 106 money and parish, public rights of way, to talk about those two issues, which I'm sure will be a lot of interest. So we'll look forward to a really full house for those two. But yes, lots of other ideas from you. So we want to make sure we've got topics for you. And it was very nice to have some feedback again this evening on my monthly newsletter. I'm pleased that is well received. It goes on a little bit sometimes, but I'll have to speak to my cabinet colleagues to tell them to be a bit briefer in future. But it's nice to have some feedback. Thank you very much. I'm glad you appreciate that. And just great evening. I think a real opportunity for everyone to listen, for the ICS to get feedback from people, lots of talking, lots of ideas, which is fantastic. And that's the whole idea of this. Amy, sorry to have gone on.
No, that's great. Thank you. So we're 3 minutes before time. So thank you all. Thanks for your time, and take care. See you soon.